To me, at its very core, equity is about fairness.
Equity means to me addressing social and racial injustices that we see in everyday life to really ensure that everyone is being treated fairly.
Equity means access to the same opportunities and resources, and that could be access to emergency care, access to preventative care, access to medications, but it could also mean access to knowledge.
It may take a different set of circumstances or different guardrails or a different infrastructure to help each individual be their best self and achieve what they need to achieve.
It's about recognizing, understanding, and taking action on the root cause issues of these injustices and making it right for our employees, our patients, community, and our society as a whole.
I think when we think about these concepts in healthcare, this can really mean the difference between life and death.
The Institute for Health Equity Research has been working on a comprehensive way to measure equity as part of quality in every aspect of the care that we provide to patients. This really allows us to use data that we have collected about the populations we serve to make sure that we are delivering equitable care to everyone at Mount Sinai.
Our focus in the Office for Diversity and Inclusion is to standardize and establish best practices for capturing self-reported patient demographic data. We continuously partner with clinical divisions to maintain patient data integrity for reporting, analytics, and research. And we do this in order to identify and address inequities. We also created a campaign to communicate to patients why it's vital that we have their correct background information. Having this information makes a huge difference in health outcomes.
We've had the opportunity to create a core equity dashboard for obstetrics and gynecology. We've been able to integrate our perinatal care measures such as our breastfeeding, our low-risk cesarean birth measures, and we look at all of that through the equity lens, such as the social determinants of health. And we know that it's not just about looking at race, ethnicity, which is so critical, but it's about looking at whether our patients have access to care based on the neighborhood from which they come.
Nurses Against Racism has been developed to the sole purpose to educate and engage every Mount Sinai Health System nurse to understand, to create, and sustain an anti-racist and equitable organization.
The NIH First initiative here at the Icahn School of Medicine at Mount Sinai is a huge investment to really promote and sustain academic cultures of inclusive excellence, where we can ensure that faculty who are from underrepresented groups and who are committed to diversity, equity, inclusion, and accessibility are optimally positioned to thrive.
I think creating that sense of belonging and that environment where people do feel welcome, they do feel safe, they feel comfortable to speak up, to share their stories should be at the forefront of anyone's journey.
I would say take the time to try and understand other people's perspectives. Ultimately, you may disagree, but individual lived experiences, they're varied, and there may be lessons that might impact behaviors.
Don't let being uncomfortable interfere with your learning around diversity, equity, and inclusion. In fact, being comfortable with the uncomfortable is the biggest sign of learning that you can imagine.
I think it's being humble in the work, staying open to the ideas of others, and recognizing that none of us know everything. As we continue the journey together, we'll just be better together.